faculties and professor. I am Dr. Durgesh Nandini, host of the day, going to announce the program schedule and take care of your question and answers and introduce the dignitaries of today's talk. As we all know, today is Changemakers Day, and today is also World Science Day. Wish all the scientists that we are happy and delighted that because of their presence, our world is growing and more of the innovations are coming to our world. Today, the guest of today's talk is Padma Bhushan, Dr. Krishna Ella. May I request now, Dr. Srivari Chandrasekhar, Distinguished Professor, GITAM, and former Secretary DST, to escort Sir to the dais. Now may I request Dr. Srivari Chandrasekhar to introduce the guest of today's talk. Thank you.
Good morning, dear students. Greetings to all the dignitaries in the audience today. And Dr. Ella Krishna, welcome to GITAM University. Thank you so much for your time with us today. Happy National Science Day to all of you. I know we all greet each other on Mother's Day, Father's Day, Valentine's Day, but unfortunately we don't greet each other on a National Science Day. I thought we all should greet each other on a National Science Day. Let us take a commitment today, from here on, every February 28th, to commemorate Sir C.V. Raman's discovery of the Raman spectroscopy, which made the material science outstanding. So we all greet each other on February 28th. Happy National Science Day. So greetings to all of you. Without further delay for today's event, I introduce Dr. Krishna Ella. While he does not require an introduction to people who have taken the Covaxin, we are all in this auditorium today without masks is only because of Dr. Ella Krishna. So big round of applause. Dr. Ella sees always things ahead of all of us. The first incidents for us in Hyderabad, when no one thought Hyderabad can also have a valley like in US Silicon Valley, a Genome Valley. He was the first person to move to Shamirpet to build the Bharat Biotech, now which is called Genome Valley. So thank you, Dr. Ella, for bringing the entire life science ecosystem to all of us. While he is a celebrated scientist, a best human being I have seen, and always looks at the world problems. While we all talk, especially secretaries, Government of India, or the politicians, the diplomacy of the South, but he is the one who always made vaccines for Africa. So he always saw whole planet as one planet and made sure that affordable healthcare is given to the Africa without any compromise. Bharat Biotech is one of the finest biotech companies in the country and across the world. Their vaccines are sold everywhere in the world. And Ella's education has been in medicine and also in India. He has many patents. His innovations are a lot. You can go through the Wikipedia to know what is Ella's background. But to give all the time and flow to Dr. Ella, I invite Dr. Ella Krishna to address all of us, which will be followed by a Q&A. And the first priority of questions will go to all the school children sitting in the back benches. So listen carefully, ask tough questions, get the right answers, and make India a great country to live. Thank you. Dr. Ella, over to you.
Slides coming. Slides will be there. No problem. I think I'm going to make it very, very simple presentation. I don't want to make it too much molecular biology, too much science. I think that you can learn from your teachers, you can learn from the Google, you can learn from the YouTube and all that. I think I'm really honored to be here. And GITAM, this is my first visit to GITAM. Really honored to be here. And I see the campus. I think you're nowhere less than MIT. Even MIT and Harvard is too crowded, not like this. It's one of the best campus that I ever seen, so far in this one. Honestly, I mean it. Okay? I've seen so many campuses all over the world. You are the best place, okay? I think I want to thank, the visionary man, Dr. Murthy, okay, how inspired of a teacher, inspired for the country to build the educational institution. The nice thing is, the grandson got all the genes of the grandfather. So the grandson, Bharat, I think he made it to happen. He has got a vision. He's maybe a politician, but politician is not that. I don't think he enjoys that. But he enjoys, building the human resource of this country. And that is what he's interested. I think we have to salute him for that. And I want to thank my guru here, Dr. Chauhan, whom I know for the last 25 years. Right from when me and my wife, only two people company, he knows me right from then, okay? And Dr. Chandrasekhar, I also know him as you have a best biologist and best chemist right here. And I want to thank Dr. Rao, Raja, and the Sastri, all of them, the faculty whom I never met. First time I'm meeting them. And all the faculty and students, and I think I'm really great honor to be here. Okay, I'm going to talk about innovation and entrepreneurship. Simple thing, which you don't see, you don't teach in GITAM, or you will not be taught in anywhere in the world, okay? It is all learned by some other experience. I think my mother told me only one thing, son, you have 9 inches stomach. How much ever money you make, you can't eat more than 9 inches stomach. Come back from US to India, do whatever you like to do, and I'll feed your stomach. And I'm from agriculture family, I'll feed you, you will not be starving, you do whatever you like. That one philosophy made me. I think, it's very important to this, no closed classroom teaching happens. And think science problem, particularly simple, young kids, and particularly masters and BSc students, think science in simplest language. If you think simple, you'll find the best solutions in the world. But you start thinking in science in a complex manner, then you will never find a solution, you will never enjoy the science. And I think, you need a keen observation. Unfortunately, we are always on mobile phone. And I think that kills a lot of things. But you keep watching. When you start watching, you'll see a lot of things around you. And I think I'm going to touch upon Bharat Biotech as a startup, as a scientist, from a farming family, what we can create in the country. And that should inspire a lot of young generation. It can be done in this country also. I think we want India to be an innovative country. We want to fight for the better ecosystem. I'm a fighter. I fight in the government, in every angle, political system, and the government policymakers. Everybody I fight. Only reason I fight for that our children, our grandchildren should stay back in India. For that, every one of us in this room can fight for that ecosystem. It's not the government who creates an ecosystem. It's we demand what that ecosystem should be there. We are there or not, but we should fight for that. And I think that is what we should all do it. I think today the world is very divided. Today you see that innovation, no knowledge and knowledge is the one what dividing the world today. Oil, rich, poor, all gone now. It is the knowledge is going to divide the world now. Which country has got knowledge? Which country doesn't have knowledge is going to control the country. Innovation is the key. If you want a higher GDP growth or 12-15% GDP growth, you need innovation is the only way. Not the service sector, not the manufacture sector, not even your agriculture sector can give double-digit growth. Only innovation can give the double-digit growth. And what is innovation? Everybody talks simple. I want to give a simple language for a lot of young kids who are here. Okay, This is all driven for the young children to understand. You look at imagination, knowledge. Knowledge has got two components. Knowledge is a degree and a skill. Degree means you got a GITAM University degree, but skill set is how to do the experiment properly. And that I will explain what does that mean, skill set. Imagination is very example. You know, the Bharat is given to architect, I want the auditorium like this, no pole in the middle. You know, he told all the architect imagined all this is requirement, he started creating auditorium like this. That's the imagination. An architect understanding somebody's view of imagination power, that he understood that he put it to paper, that is called in the sort of imagination. I'll again explain. I think Albert Einstein said, imagination is more important than your knowledge and skill set also. So imagination is crucial, and I think what you all should aim. I'll tell you a very example. I'm not talking about the religious connotation here. Don't interpret me on a religious angle. An elephant head on the human body. You look at the internet today, the rat head is put on the mice. And dog head is also taken, one dog head is put in another body of a dog by Chinese. Okay? Whether real or not, I'm not questioning. I'm only talking about imagination power. Look at Golconda, 4 kilometers down, and you can clap. Somebody can hear 4 kilometers above. That means there was no sound engineers, there is no GITAM University, there is no engineering department, nothing. But still, the imagination power of the sound system, they imagined that and created Golconda. Like that, so many examples are there. You look at it, you know, you have catering technology degree. The madam is a hospitality. You don't know how to make a good cooking. Will you hire him as a cook? Simple. You may have a degree, but you don't know how to make a good idli. You will never hire him a cook. Am I right? Will you hire? Ladies? Yes or no? You will not hire. Am I right? Even degree is good, but you don't know how to make idli, you will not hire him. I think the most important skill set is important. Suppose if the guy here, if he knows a skill set, he knows how to make a 2 rupees idli, good idli, he can survive as an entrepreneur also. That skill set is so powerful. So please keep in mind that important. And you look at nanotechnology, it's a diamond cut, is a nano precision. And goldsmith, who is doing a goldsmith for ladies jewelry, is also nano precision metal. If something bent, the ladies will give back the jewelry, it will set back properly. So that means precision of nanometer. And this guy, he may not have a nanotechnology degree from GITAM, but he is truly a skill set which has got all the qualification to be a nanotechnologist. Okay? So he doesn't have degree, knowledge, that's all. Innovation fast. India was the greatest country. India innovated zero. How they innovated, we don't know. Even now, we don't know. It's beyond our imagination power. How they come out zero in a concept. And the zero is not there. Today, software is not there. Everything is driven by that angle. So Albert Einstein said, we really owe to Indian who made it zero. And steel was invented by Indian. Cataract surgery, diamond cut, India, ink, you know, whatever ink you're writing. All India was the greatest country in the world. That's how many innovations have come to India, because we had so much of knowledge in the country. And I think present is, we lost out innovation. Many people who had gone to US, many people know canola oil. The canola oil is nothing but mustard oil. And can means Canadian, vola means oil. And they took seeds from India, Canadian, and 1962, they made it to grow as a canola oil, but they don't want to call as a mustard oil. If they call mustard, you compete with India. So they call canola oil. Today, 50% of agriculture export, almost $64 billion of agriculture export of Canada is only of that one oil, which they took seed from India. We had it here, mustard oil. All North Indian pickle is made of mustard oil. East India, everything is totally mustard oil. But still we have not understood the value of mustard right in front of us, but we didn't realize the value of it. How many people knows Manchununa, Nallanna, Tamilian? Anybody is there Tamilian? Tamilian? No Tamilian. All Telugu, good. So, Vallanna, Kannada, you look at all the language, whichever language you can read. You can read in South Indian language. All South Indian language, till oil is called good oil. You go and ask your grandmother, why it is called good oil? Or you ask any scientist also in the country, why it is called good oil? Nobody has got an answer. Even now, nobody has got an answer. So somebody said it's got a lot of antioxidants. Then I asked a question, if you put an antioxidant in groundnut oil, will it become a good oil? It doesn't. Okay? So even there, the till oil is in front of us, but we have not made as a product and made it as a brand of the country. So that means the science innovation is right in front of you, but we have not realized. And we drink orange juice. The reason we drink orange juice, Americans are drinking, Europeans are drinking, so we also should drink orange juice. We also become like Americans and Europeans. And you look at Musambi juice. Have you seen Tetra Pak? And Kino fruit in Punjab. Have you seen a Tetra Pak? Jamun, black jamun. Have you seen a Tetra Pak juice? This fruit has grown in US, they would have made a Tetra Pak. So, but we have not realized, I think the food science department, Dr. Changemakers told me, food science department, I think you all start thinking in the direction. There's innovation, you don't have to copy Americans. Don't copy Americans, don't copy Europeans. There are a lot of things in front of you, but you're not realizing the value of it. And we ignore. We always drink what Americans are drinking, we want to drink that. Even copy that also, unfortunately. I'll tell you another example. Coconut, everybody said it's the highest saturated fatty acid. You should not have coconut oil and it will give a heart attack. Now, you know, in US and European, every day they're drinking 1 tablespoon of coconut oil. Now it's protecting the Parkinson and Alzheimer's. And Kerala people, they bath with the coconut oil, they drink coconut oil, and they eat coconut oil. Everything coconut oil in Kerala. But they don't get heart attack. But they give heart attack to others. But certainly, you see that Parkinson and Alzheimer's, the coconut oil is right in front of us, the coconut oil. But we all thought it is not useful oil. Like now you look at laddu. Laddu is a basin, am I right? It's a protein. And protein mixed with water, poured into oil. Oil is a lipid. Protein, powder, lipid, and then put in carbohydrate, that's sugar. You see how balance of nutrition? You have protein, carbohydrate, and sugar. I mean, sorry, the lipid, all three are composed. And look at now samosa, with the samosa, we were eating with chutney, now we are eating with ketchup. Americans, even ketchup made it. My grandson was asking me, I want to eat idli with ketchup. So the situation has come that he want to eat the idli also with ketchup. So the chutney, have you seen a chutney powder? Anywhere in a sachet available, we could put in the water, it becomes a chutney. We start talking big thing in the world, but we forget the fundamentals of science at the basic level. That is the problem of India. India, we forget the fundamental, we go at a top level. And the top level, without wall, we will collapse. That is a simple example. I think one nice thing about future, Indian families are believes in education. The parents doesn't mind selling their house for child education. So the greatness is of the Indian culture that we are knowledge seeker. That is going to keep the going. How to kill innovation? I think everybody has got a mobile. 2 mobile. How many people has got 2 mobile? Only 1, 2. So remaining who are not lifted, they also have mobile phone, double phone, but they don't want to lift. They don't want to be identified. So 2 mobile phone. You shake the mobile phone if some message doesn't come. See, that means you are paranoid. You're always watching on that. And your mind is taken away by that. So you need to stopping that one. Start looking at the surrounding. How the auditorium looks, how the lighting looks. You keep looking at, ask question, why this is not being done like. You keep asking, you will get an enthusiasm and learn how to learn after innovative culture. We are a startup, me and my wife, and we are 2 people. Now we become 4,000 people in 5 different cities. We are in different locations. And Dr. Abdul Kalam, we are a startup. I'm just from small farming family. I'm not even 1/10 of what Bharat is, okay? Not even 1/10 of my family. I was such a farming family, nothing else. So why I'm saying this, you don't need it to be money. To build the country innovation culture. You need a passion. You need a passion that. You have a passion, you can achieve. You can be fighting. Nothing is easy in this country, but you have to fight it. That's where the entrepreneurship comes in. It is a fighting system. And I think Abdul Kalam launched our hepatitis B vaccine. And I was a startup, I was a Chandrababu Naidu advisor at that time, 2001-2. We created a Genome Valley. Today it's become the largest cluster in the country. And we made a ROTAVAC. India should make innovation. We said we should make a new vaccine. We made a new vaccine when the project started, when there was no building also. And I think Dr. Chauhan knows. And Roger Glass is there, Harry Greenberg, Dean of Stanford, and Roger Glass of NIH CDC director. All of them are there. And Dr. Bond, who is there, my guru, is one of my mentor, Dr. Chauhan's close friend also. We started the initiation of the program. And we did the first efficacy trial in the developing world. I'm going to ask a woman some question. I want to see how many people are going to lift their hand, okay? We did an efficacy trial in a community-based trial. The community-based trial means your mother has to give their baby, as soon as the baby was born, has to give for clinical trial. So now I am going to ask, how many women is willing to give their baby for a clinical trial? How many? Not even one. So how do you progress of science in this country? That means Americans has to innovate, America has to do the clinical trial, and then you produce it, you sell it at $100 of a dose vaccine, you buy it. Then you keep grumbling, oh, India is not making innovation, India is not making big science, Indians are useless people. You see how we are not believing our own research in this country? We have to recruit 25,000 pregnant mothers to get 10 to 15,000 babies for a clinical trial. And again, the Gates Foundation gave us a grant for this project. We should not bribe the mothers. So what we did is, we give 3 years health care to mother and child. We give an ambulatory vehicle with a mobile phone. If she presses the button, the ambulatory vehicle will be there within 10 minutes and taken the mother and child, whether irrespective of the who gets what disease, doesn't matter. So they've all been taken. So we're given ethically that help of this one. So if India has to do the clinical research, is the bottom line, is very important. And we did quite a bit of this thing. Prime Minister launched the vaccine, and this is my grandson. He was the first one to take a vaccine of this vaccine, rotavirus vaccine. And I think this is again a third company in the world after GSK and Merck. We are number one in the developing world, but not number one. And so we made a first molecule, typhoid conjugate vaccine. Child is the whoever child who got 9 months baby. The existing typhoid vaccine cannot be given to them. So we made one polysaccharide conjugate vaccine. Now I want to ask the gentlemen here. Now woman is over. Now I ask the gentleman now. Now I'm going to give 1 glass of water with bacteria, typhoid bacteria, virulent bacteria. It'll knock you off for 45 days with fever. Okay? How many people are going to drink in a clinical trial? Oh my God, one person, 2 gentlemen, 3, 4, 5, 6, 5 at least, not bad. So now you said me why we call gentlemen. Okay? So I'm just kidding. I'm not discriminating any woman for that. So don't worry about it. So I think you have to, we can't do it. In India, all of them are infected one way or the typhoid. We can't do the human challenge study. So we have to go to UK because they are naive population. They have not been exposed to the typhoid at all. So we need a human people who are not been exposed to the bacteria at all. So we did 140 people, human challenge studies, and that came 87% efficacy in the human challenge. The next question, oh, you're done in this room, the efficacy trial, human challenge studies, will it work in the field? Like entire GITAM University is vaccinated and Mahindra University is not vaccinated, will it protect? The next question is the people will ask the global, when you develop a new molecule, the people, a lot of anti-ideas comes in. So we did effectiveness, we called effectiveness studies in various, about 1 million children vaccinated various parts of the world in this thing, and funded by Gates Foundation again. We did that, and we asked the next question, Karachi in Pakistan, Hyderabad, Pakistan, 200 children died of not responding to cephalosporin drug also. So we said, we gave 200,000 doses in Karachi, Aga Khan University, vaccinated and protected from cephalosporin. This is the first evidence that vaccine can protect multi-drug resistant strain in the Karachi, Pakistan. And then Nature said this is one of the best products came in the world. And COVID vaccine, very simple. You look at it, very simple. Most of the neglected diseases are in Asia and Africa. You look at the drawing. The Asia and Africa are the neglected disease. All neglected disease turns into pandemic. Okay? So why neglected disease is important? Because those are the one which are potentially for the this thing. We created BSL-3 production, world's first BSL-3 production facility, right in Shamirpet, right here. I think any of the faculty are welcome to visit our BSL-3. These world's BSL-3 labs are there. BSL-3 lab is there. Wuhan is a BSL-4 laboratory, not the production facilities. BSL-3 lab everywhere. BSL-4 lab also is there. But production facility is the first one. And we made one of the new concept of Covaxin turning into more of a Th1 response rather than Th2 response. The Th2 response will go up, immune response shuts down. And this chemical that you see IMDG, Dr. Chandrasekhar, and IACT, 18 scientists, 3 months, day and night, we worked when COVID time shut down. 18 or 25 scientists worked day and night, and we made that compound, synthesized right in IACT under Dr. Chandrasekhar, made it and absorbed to the aluminum hydroxide gel. We shift the immune response so that when you test it, you may not see the IgG response, but then you have protection against variants also. The nice thing about Th1, it gives lifetime immunity. For example, child vaccine, you give 3 doses, it's a lifetime immunity. That is because of Th1 response. So we created that type of response that protect against variant. We published 27 publications on Covaxin alone. We did a human challenge, and we did one of the efficacy trial. This is only efficacy trial in the developing world, and the third country in the world after US and UK. Third was India, who did the efficacy trial. More than 1,000 personnel, and when the country was shut down, and ikigai is a multinational company, they did site management. And this is the second largest efficacy trial after Pfizer. And we're third country in the world to do that. And we did export to a lot of countries. And we made a nasal platform technology because the COVID and flu all are respiratory pathogens. If you can prevent the disease right here, it doesn't go into lungs, you protect better. So that then the platforms are not available. So these are first platform that we produce nasal drops. You put the 4 drops on the nasal, it gives you immunity we call mucosal immunity. The nasal, all the membrane is getting vaccinated. So any virus that touches, it get neutralized. We made that one. And I think, we lead the neglected disease. Thabo Mbeki came to our president. He said, you should help Africa because you have moral obligation to Africa. I said, why should we help Africa? I said, I'm a US citizen, why should I help? He said, we exported Gandhi to India. That's why we got a freedom. If you have not exported Gandhi, you would not have got the freedom. So therefore, you have moral obligation to help Africa. So that touched my heart, actually. It really touched my heart. See, we're all scientists. We live with a certain human touch. So we made one of them. We found that one of the poultry bacteria is going to humans now in Africa. This is one of the severe disease. Anybody who's got a malaria infection or comorbidity gets poultry bacteria touches, 100% person should die. This is one of the biggest problem in the African continent. So we partnered with Wellcome Trust, gave the funding, University of Maryland partnership. We did a phase 1 trial in US, Baltimore. We completed phase 1. Phase 2, we completed in Malawi in Africa, and now moving into different conjugate vaccines. We are also making some of the research, life science, working on tuberculosis. We also probably 2 tuberculosis vaccines in the world, which are in the phase 3 trial. One is the GSK, and second is ours, which we are partnered with a Spanish company. We both partnered, only 2 vaccines in the world on MTB, tuberculosis vaccine, which is in the phase 3 trial. And I think we're also working with the malaria, with the Gates Foundation, and also GSK. GSK is shutting down the plant in Belgium, and shifting the entire manufacturing to Bhubaneswar. This is going to be manufactured in Bhubaneswar, malaria vaccine. We're going to be one of the important player in the malaria vaccine. And I think we sold more than 10 billion doses, and we're very aggressive clinical research company. No company in the developing world, including Korean and Chinese, are not there comparing to us in terms of clinical research. And clinical research is very critical. Every product, it takes 10 to 14 years product to come into the market. Vaccine is not easily comes out, not like pharma product. You do bioequivalence with HPLC profile, you come into the market. Vaccine needs extensive new molecule. Rota took almost 17 years for a come to product. Typhoid conjugate, it took 11 years for us to come into the market. So it's a lengthy clinical trial, various country trial. We are also a very good research company, publishing a lot of publications. And we are also very aggressive in patents. And Gates was there, Prime Minister was there, and we are international. So now, how as a scientist, how I get some ideas? Now, these will be interesting, simple ideas. Now I'm coming at 6, 7 slides. I'm going to close it quickly. Okay? How he gets ideas? You look at it, farmer in Kolar district doesn't commit suicide. Nagpur farmer commits suicide. Ask a simple question. And Indian government agriculture ministry puts a big committee. Why Nagpur farmers commit suicide? Farmer is an entrepreneur. He borrows 100 rupees and he has to get recovered 150 rupees. The problem in Nagpur farmer, they grow only cotton crop. If cotton monsoon is failed, the cotton crop is destroyed. If there is no price, cotton is gone. Farmer commits suicide. Whereas Kolar farmer doesn't commit suicide. The reason they don't commit suicide, they live on agriculture, other allied agriculture, goat, sheep, sericulture, and the poultry, all those allied agriculture. This allied agriculture keeps the livelihood, even if the crop fails. Do you need a big microeconomist and big economist, Nobel laureate economist to come out, tell us what's the simple solution? That's why I tell you, think problem in simple language. You'll find the best solution. Again, my message, first message, comes the same story. Okay? You don't need a big scientist. So we made now veterinary vaccines, BSL 3 plus, this is the second one. There's a Fulbright in UK. The first facility of BSL 4 is actually BSL 4 type of production facility. One in Fulbright, second one is in Bangalore. We created that. And we call FDA, am I right? We call Food and Drug Administration, am I right? Food should be treated like a drug. Do we treat like that in India? We don't treat. So now it's a concept has come because we are eating every day food should be treated like a drug. That's very important. So I put now you see that many masalas are getting rejected in the US and Europe and Hong Kong, Singapore because of salmonella contamination. Many bacteria are flowing through to this, the curries and all that. We said, okay, we'll make, this is how my grandmother was making spices. I think young kids would not seen this. Have you seen anybody, the first photo? Okay, the young generation would have not seen. Have you seen young generation? This is how my grandmother used to make it. And when I was at school, I don't go to school properly. My mother will torture me, put this ground until I ground. My grandmother will stand there, see that this bugger doesn't escape from there and grinds it until he grinds, he cannot go. It's a punishment for me. I remember all my childhood. Okay, I said, okay, if my mother made me to do like this, how the spices made? You see 270 degrees temperature, and spices has got a medicinal value. Okay, it ground at 270 degrees temperature, all the alkaloids, everything is gone. Flavonoid, everything is gone, all the spice value. And then you got a microbial contamination, it is not stored. So this is my grandmother's spice, it made, grounded, immediately used it in the sambar. Okay, that means there is no microbial contamination. And why wood stick is given? Well, wood stick is given, I don't know why my grandmother, my great grandmothers have done, all our grandmothers have done, wood stick doesn't produce heat. See how grandmothers are better scientists than us? They're better scientists, 1,000 times better than. So we made now a commercial like this and killed the whole, and then people are using ethylene oxide to bring the microbial load. That's what you see the controversy of Singapore and Hong Kong banning the Indian spices because of ethylene oxide to bring the microbial load down. So I said, okay, we make a cryogenic spices. I made now cryogenic spices with the liquid nitrogen with the minus 170 degrees temperature, grind them, and we made microbial free. We fill in the sachet, in the packet, pass through gamma radiation. Now all the bacteria are killed. So literally it's like a food to be treated like a drug. So we made no chemicals used anywhere in the process. Simple process. So we made now 99% microbial free. We keep 1% error of lab testing problems if anything happens on the regulatory. But we made and then I like pickles. Oh, sorry. We made all those microbial free and all that. But I like pickle. The doctors tell you not to eat pickle because I have blood pressure. When I have blood pressure, because of sodium, high salt means sodium. So I can't eat sodium because of that. So I said we brought up plant-based salt and I brought 70% less sodium. We claim 50%, but although we have 70% less sodium in the pickle and gingerly oil. You know, this is how my grandmother's and my grandfather's days were made. This is called cold pressed oil. You know, English word now called cold pressed oil. This was grandmothers making cold pressed oil. But we call it gold pressed oil now, the new generation, okay? And it's all old generation oil. That is, we made that one, we buy it at a very high expensive rate, cold pressed gingerly oil, which is, I told you, manchanone, nallanne, all those oils, okay? I brought the first slide, brought back the same idea, here. Put gingerly oil, now I made 70% less sodium, and it can have blood pressure people, but same salt taste, because pickle is eating for salt taste purpose also. So salt, same taste is there. And I think we made a gamma radiation plant. We used the approved facility in Bangalore. And what needed farmer needs help in marketing. Farmers are very intelligent in this country. They can produce any product you ask them, they produce. They're very intelligent. They're wonderful entrepreneurs. But what they need is a marketing. So we said now, we just supply and demand. So all economics, simple economics. If you have a supply, you pull the supply out of the market a little bit, 20% extra pull out from the market, if the price goes up. Both domestically and export, both goes up. Simple as a principle, nothing big science. So we said we pulled out from the Bangalore, Kolar district and Chittoor district, 20% of mangoes out from the market and exported to US. And we paid 150 rupees per kg to the farmer. Now, because 150 rupees kg we are paying to the farmer, they're putting every bag with the one bag so that insect doesn't come in. Every mango, every mango is now packed with one bag is covered. You see how they brought up phytosanitary issues and insect control in an intelligent manner. As soon as the price is going up, they are also getting into intelligent manner. We exported 800 tons mangoes to US. And then future, my last slow slide, deep biology. Please keep in mind, the science, in next 2 years, you're going to see a totally revolutionary science. What you're seeing now, protein science, biochemistry, all will be outdated. Even computer biology, all will be totally taken out of science. The future is deep algorithm. And engineering department, mathematics should look at it. New protein science and deep biology is going to change the field. I'll tell you some of the examples. You know, what takes the 200 million proteins, the 200 million protein would have taken 200 years to solve by using NMR structural biology of the protein. It would have costed 200 years, but they solved it in 1 year by AlphaFold 1 and 2 software, which got Nobel Prize recently, Google guy and other University of Washington, Seattle guy, all of them got a Nobel Prize on this structural biology, totally revolutionized the structural biology. So what is going to change the whole field in next 3-4 years, you're going to see a totally different science altogether, okay? So what you're going to see now, the computational biology is totally changing. So we are talking about theory before, now it's a practical. You're going to see new textbooks are going to evolve in the science. New proteins, reverse science. Earlier, we used to identify a gene, and from gene, we know the decipher the protein. DNA to RNA, RNA to protein. Now you don't need. Based on protein, what protein you want, you can design and go back to DNA. Opposite science. So you're going to have a reverse science is going to happen in the world. And what they're doing is, if a monoclonal antibody, it binds to a receptor on a new, say, nerve growth factor, binding to on nerve on one particular receptor, they'll find one catalytic region, which are very defined, and change the mutation in that place, make it more binding, less side effect, find that one, and then make a new gene for that. They're going to take a totally new gene, and then that is what the realities are going to be. Like, for example, PET bottle. You want to make a protein which can, PET bottle can be just solubilized in less than half an hour, 30 minutes. It's going to be reality. Please keep in mind. In 30 minutes, PET bottle you put in the protein solution, it will dissolve by protein. That man is going to create totally a reverse protein science, going to engineer, and those sort of things. It's going to be against nature, unfortunately. It's going to be against nature, but it's inevitable. Okay, the 200 million will be modified against the nature, new man-made proteins, and whether plastic degrade or pandemic, one can make more pandemic potential of a virus by using a structural biology. The whole thing is going to phenomenally change. Keep looking at the science is changing. And thank you very much for giving this opportunity. Honored to be here.
Thank you so much, sir. I'm sure all of us are going to remember the example sir has given till the death. May I request Dr. S. Chandrasekhar to be moderator for question and answer round.
Thank you, Dr. Ella, for an outstanding talk, and all the audience are mesmerized, and I'm doubt now they'll ask you questions. But we open the session for question answer. But to get the ball rolling, I'll ask the first question. Ella, do you think a vaccine can come for non-infectious diseases like cancer? Or do you think we can get some vaccine which can cure all diseases?
No, cancer is going to be reality, a vaccine. Going to be reality, but it is not going to be one vaccine for everybody. It's not going to be one vaccine. Because if even it is a prostate cancer, the mutation from one individual to another individual is different. So it's not going to have one vaccine candidate for everybody. So each one will be identified what mutation is there, take that gene sequence and make personalize that vaccine candidate, give it to him. So that is going to be 100% reality, but not one vaccine candidate. If somebody says one vaccine candidate for the entire community, no, it's not likely to happen, but it's going to be personalized vaccine candidates, yes.
Do you think, like the vending machines, do you foresee vending machines for organs?
I've not talked about it's reality. Pig, porcine, we call porcine. They have the heart transplant, heart and kidney now going to be used as a pig as a missionary. Now what they did is they made 8 genes. They knocked off immunocompromised genes. They knocked off by using CRISPR in a pig, which are human rejection system. When you put a foreign organ into our human body, it rejects. Body try to reject. That's why we give cyclosporin, anti-immune suppression drug. So what they're going to do is now the pig can be knocked off some of the gene and make organs to grow from pig and used. And actually, you can look at the Google search. Kidney has been done already, but heart was taken recently, about 8-9 months back. The patient was alive for 45 days, and he died afterwards for other reason. But he was alive with a porcine heart was transplanted on human body. I think organ will be a lending mission. I don't know, but certainly the pig is going to be a source of organs are going to come from there.
I think so. Respect pigs is the message.
I mean,
so we'll open the questions to first young school children behind, then we come forward. So the mics are with the colleagues here, volunteers. So if someone raises the hand, I'll push the mic there.
The girl is lifted there, the girl.
Go last, yeah.
The boys are sleeping. Actually, they're watching mobile phone.
Good morning, sir. Good morning, everyone. I'm Hafsa bint Yasin. My question is that how is one supposed to handle the setbacks and failures in the process of innovation? Because when someone is coming with ideas, they are meant to face the obstacles, and failure is one among them. So how do you handle it? Thank you.
That is what you want to be an entrepreneur. That is where the struggle is.
Yeah.
Okay, you fight the system.
Yeah.
Don't leave it. If you believe in your idea, okay, don't. There are a lot of, see, I have not told a lot of stories. In a Covaxin time, you know how much negativity has happened. India cannot make a vaccine. India lousy vaccine. All sort of things. You know, here you have 3,000 TV channels. Everybody picks up the TV channel and they want to get into limelight. You talk against Indian company, you always get the highlight, much more. You can't talk against multinational, but you can talk against Indian company. We are all soft target. But you know, don't worry about it. Fight it. If you fight, you will become a successful entrepreneur. But you verify your idea, okay, from various directions. Listen to all the criticism, okay? Listen to all the criticism. It's good for you because you don't want to step in something where you are looking at it in one direction, you have not seen other direction. Somebody else tells you this direction can go wrong like this. So you will be better matured. Take all the criticism, but decision is yours. Decision has to be yours. And you will succeed, take my word. You'll be fighting 1 or 2 years. Fight in the family, fight with a friend, fight with the system, fight with the government, all will happen. Okay? That is where the entrepreneurs are fighting. Okay?
Thank you, sir.
Good. Another lady.
I think come
there.
this corner.
There. See, I told you, ladies only asking question. Boys are, looks like they're eating biryani. I think they're waiting for biryani to eat.
Morning, sir. So my question is like, according to you, sir, what is India's potential and future in vaccine production and how it's going to contribute globally?
Indian vaccine industry you are talking about, am I right?
Yes, sir.
Indian vaccine is the only field in this country. We excel over all other countries in the world. Vaccine field. All of us together, all the companies, Indian vaccine manufacturers. We are the major player. 2 out of 3 children in the world are vaccinated with Indian vaccine. Okay? So Indian vaccine industry is under-recognized, but they are the best in the world. They're nothing less than us in the world. Whether Serum Institute, us, all of us, are, you know, really a global player in the vaccine field. We are ahead of the thing. Future of vaccine is not going to be great opportunity, but now vaccine is also going to be focusing on, as Dr. Changemakers said, on cancer side and on other one, multi-drug resistant. You're going to have more problem on multi-drug resistant. The vaccine might go in that direction instead of childhood health alone. Okay? And also remember vaccine, it is not just healthcare of the people alone. A pandemic comes, the national security is a vaccine. So vaccine, if vaccine is not there, your national security is in jeopardy. Economy is in jeopardy. Okay? So vaccine is also not only healthcare, it is also the country's economy is also important.
Yes, sir, that is what I wanted to know. What are the different factors that contribute to this? So,
Different factors. It doubles, it all, the science is changing, fast changing. We were in childhood vaccine, suddenly pandemic came, we changed. Now we are looking at multi-drug resistant. So you see the science is changing rapidly. We also need to move. And how the structural biology is going to change is a stress for me right now. How I'm going to cope up for the future. The structural biology is changing. Now you don't need an antigen candidate can be identified in lab within a month. So the structural biology changed now. So the fusion of, I don't want to talk, pre-fusion, post-fusion, all changing science based on structural biology is coming out. New novel candidates are coming out. Okay? It'll be a different field altogether.
Maybe a question from here.
thank you,
Please go
sir.
ahead. Yeah.
Sir,
You're done.
what is the possibility of AI agents to be used as in clinical trials?
Yeah, AI is going to play a major game. See, don't think AI is a science itself. Okay? AI is a tool. It's a tool to understand the entire big data to analyze and make it. People are start thinking in AI, see biotechnology field. Biotechnology is not a science. It's a tool to understand whether microbiology or plant tissue culture or animal biotechnology, anything you want to understand, biotechnology is a tool. Like AI is a tool can get into engineering, biology, every science, clinical trial, everywhere it can get in. AI is a tool, but not a science. So keep in mind all of you, AI is not a science. You need to understand how each place AI can introduce as a tool. If you start thinking clinical trial is going to be phenomenal, pharmacovigilance and all those angles is important. And a lot of data is there in the world.
Good morning, sir. Sir, I have one doubt. In the society after COVID, people are feeling, the younger people are getting heart attacks, and some misconception is going on because of the vaccine, COVID vaccine. These young people are getting some heart-related problems. Is it really because of that or some other things?
I want to say openly in front of camera, okay? Covaxin doesn't cause any heart attack problem. That much I can assure. It's the safest vaccine. Even my grandchild was given my vaccine. Because it's old generation vaccine, very old. See, I always believe the humans, you need a safety is important. Vaccine field goes to the healthy people. So safety is the most crucial. When I was talking about safety, everybody laughed at me. Oh, other vaccine has got a 99% efficacy. Yours is an 82% efficacy. All sort of balancing people talked about it. I never bothered. I said, safety will speak in the long run. And this is the only platform doesn't go inside the body. Okay? Doesn't go inside the body. It stays right here, the vaccine, what you injected, what you're injecting like injectable polio vaccine, pentavalent vaccine, the same concept. We brought the oldest technology for the safety point of view of the vaccine. So Covaxin, I can give you an undertaking.
Thank you, sir.
Good morning,
I think we
sir.
go there. Yeah, please.
Good morning, sir. I'm Shanmugh. First of all, thank you for the fantastic presentation, sir. You did instill a feel of a nationalistic feeling. So my question is, sir, you have said that keenly observe your surroundings and question everything. I do that, and sometimes I hear the response that we did not question our parents, so you don't question us. Do you think there are any sources that we can look at?
I mean, my son is questioning me every day, morning to evening. So when I'm scared of picking my son's call also nowadays. I'm scared of picking my daughter call also. So I think kids are, I never questioned my father, okay? I questioned only when I got an agriculture degree. I went to my father. I told him, no, you are a useless fellow, you are an old man, get out of it. I am agriculture degree, see my degree here. I want to do agriculture. He said, your agriculture degree is useful for bank job, get out of it. You are not, doesn't have skill set to do agriculture, okay? But my son is not like that, my daughter is not like that. I think you are questioning, the way you are questioning, I think you have a liberty to ask question. The world is changing, science is changing, and young generation are not bothered about, we had all economic pressure, our generation. Our job was critical for us. But your generation, job is not an important. Today you are all confident citizens. You feel that, I'll do this. If not engineer, I'll go to something else. Like that you have all the freedom to do it. Today the economy is also giving that opportunity today. A fellow who can talk in Hindi, Mr. Telugu, without one English word, he can also be best anchor in the TV channel. So the country is changing totally. So So you have opportunity. Keep questioning. Okay, keep questioning your father, brother, and your friends nearby, slapping them also, slap their face also.
Well,
you,
I'm
sir.
looking at the balcony seats. Anyone from top?
Sir, once.
Anyone there at the top? We don't ignore you guys actually. There's one hand there, yeah. Your mic there to ask a question? Okay. Give me one second.
Good morning, sir. So my question is, actually, a lot of us are not well aware about the nutritional benefits of. Yeah.
Oh, sorry, sorry.
Okay, we'll go. Give you a second.
Changemakers said upstairs, so I'm looking at a sky. I'm looking at Mars. Where is Mars?
Wait for a second. I think balcony, please. Balcony.
No, she picked up. Go ahead.
Good morning, sir. So my question is actually, most of us are not well aware about the nutritional benefits of the natural foods around us, right? So during clinical trials, do you think there are any nutritional interventions, specific of them, which can actually enhance vaccine efficacy?
Can you repeat the question, please?
The question, if you're sorry. Somewhere
My question is, during clinical trials of vaccines, do you think that nutrition plays a role, or are there any specific nutrition interventions that can actually enhance the vaccine efficacy?
Yeah. I think in human challenge studies in Oxford, one nurse was severely had a placebo effect. In a sense, she was a placebo vaccinated, okay, double blind. So she was really hospitalized more than 45 days, okay, and a human challenge study. That was adverse reaction. And also in all our clinical trial, some people are sensitive to some of the drug, and we watch that, we stop the patient and report to all the regulatory agency, this is a problem. And we report all the adverse reaction. Because more the adverse reaction is known in the trial, is good for us, so that we can put our liability in our package insert, so that we are safe. So I think we take it every adverse reaction very seriously and make it a process that continue.
Well, actually the question was, if you give a vaccine and give nutritious food, will it work better?
Oh yeah, it is true. Actually, a lot of probiotics which are coming now. Okay, the probiotic is one of the things. See, good nutrition always helps. Your malnourished child doesn't get much immune response. It's understood, the old theory. But now the probiotics are coming now into the big field, where gut microbe can influence the immune responses. Even diabetic, even cardio. Now the people are saying gut microbe is going to be a major play. But how do you dissect the science? It's a complex science. Between a bacteria and a human, how do you study that? Is a tough field to. We are into the game, but still the nutrition does impact on the vaccine.
Thank you, sir.
So now we go business class. Please go ahead, yeah. Hey, talk loudly.
Yeah. Close, mic.
Good morning, Dr. Ella. I'm Dishant from Loyola Academy, and the presentation which you gave was really amazing. So thank you for the presentation. So my question for you was, there was very less time to make vaccine, right? Usually, as you said, it takes 10 to 14 years to make a vaccine, but you produce vaccine around like a year. So I want to ask, what are the challenges you faced from government or personally to make the vaccine?
See, I'm a scientist. I go not on the return of investment. Typhoid conjugate vaccine was not important for Americans and Europeans. For me, the child in India who are 9 months, 6 months baby, or get the most of the bacterial contamination because they lick a floor, contaminated food and all that. So our concept is different. As a scientist, it's a challenge for me to say this child vaccine is so important compared to the US and Europe. It was a tough job for me to convince, but I didn't leave it. I moved what I believe in it. Okay, I moved it. Coming to the government agency, government agency, if it is approved in US, they approve easily here. Okay, when you are first time, you have a lot of resistance, but you have to fight. Okay, so I keep fighting. So that's why I lost all my hair now. Okay.
Thank you, sir.
We'll take 3 more questions actually. So here, okay.
Sir, myself, assistant professor in A&S department. I publish a paper on COVID-19 vaccination, classification of opinion mining with semantic knowledge system. My work is on my student data set on my college, sir. So now some are vaccinated, some are not vaccinated, some 1 dose, 2nd dose, 3rd dose. I want to do further research that you can create one more vaccine. If some are affected with some non-vaccinated or vaccinated 1, 2 zeros, some more research can be done on this area.
Sure. See, one thing you remember, vaccine doesn't mean somebody not vaccinated is protected. That doesn't mean that vaccine is required. So you imagine one thing, if you suppose infectious disease in this room, if the flu virus attacks, all of them will not get the flu. Few people will get, few people will not get it. Okay? So the nature selected, the virus also chooses few people and their interaction with the body, it changes. So some of them are resistant to the infection. So that doesn't mean that somebody was not vaccinated is protected, means that is naturally protected also in our life. So you will have a heterogeneity in a population. And if COVID was there, then it should have wiped out the entire 7 billion population. Many people are not vaccinated, so they were protected too. Okay? So it's a nature corrections, natural interaction between a virus and a human body. See, in your body, it may react differently, in my body, it may react differently. So each one is different.
Excuse me, sir.
Use the mic.
But there's no markers to identify that right now, honestly. There's no marker.
Is the mic fixed on the balcony?
Yeah.
Good morning, sir.
Okay, then we go ahead.
Myself, Khushi, and I want to ask a question that in a generation of AI, basically most of the, as you said, AI is a tool, but it has taken jobs of many individuals, but given the jobs to many individuals at the same time. I want to ask you a question that as a life science student, how we can secure our job with the help of an AI tool and life science?
Very good question, very good question. I mean, you take my word, life science job cannot be taken up by the IT people, take my word. IT people are going to lose a lot of jobs now. So don't worry about it. A lot of IT people are going to lose jobs because of your chat GPT and all that, they can make their own software now. Okay? You don't need people also now. So I think we are going biology needs biologists to understand science and to execute the project. So you will not lose the job, don't worry.
Okay, then we are out of time.
Good morning, sir.
We'll take questions later. I think we're stopping here. I think we are at 11.
Sir, one crucial question I want to ask.
Everyone has a crucial question, but okay, we'll take you.
Yes, sir. Sir, my question is that I'm Dr. Priyanka. I am also from Nagpur.
Sure.
Born and brought up from Nagpur. You had given 2-3 examples. And my first question is, what is the future scope for functional foods and nutraceuticals? Because I had done my certificate in that. So you had shown that spices and all. So we had learnt all the pigments. So how you can relate the vaccinations and bringing of nutraceuticals?
See, I have a less knowledge on nutraceutical and functional food.
Yes.
But definitely, nutrition is going to be tailor-made for the people. It is going to come. Okay? As the wealth is increasing, already nutritionists are talking to somebody how to lose weight. They're personalizing now nutrition. I think whether functional food, how it is going to be reality at a bigger scale, I really do not know yet. But I think we need to see how the market shapes up.
And is there are consequences if we are not having that booster dose after 2 vaccines of Covaxin?
You don't need any more. Just leave it now. I think you're happy.
Okay.
Just,
okay, the balcony question. Balcony fellow came down. Last question. Yeah.
Yeah.
Okay, thank you, sir.
Oh my God.
Stop. No, I think he came down. Please go ahead. Yeah.
He came down. He gets it. The moment you came down, the battery is not working.
Hello. Sir, good morning, sir. So, I want to ask a question that at the starting of the session, at the third point, it was like our children and our grandchildren must be in India. So, what's the reason behind that it should be in India? And is the education system is right now is very good enough to be in India?
You should ask the Prime Minister of the country.
Sir, actually, like many...
Or Bharat. Ask him to raise the Parliament question. But I think it's a good question. See, let's take example. Don't form a negativity about India. Okay? India is 1.4 billion population. Don't look at it as a liability that one. Okay? Look at it. We are the highest exporter of human resources in the world. Okay? Our import is not coming from IT businesses and all that. The many people who have left, who came and contributed. Just imagine all the Indians from US and Europe and Africa is pulled up to India. What will happen to their economy? ask other question. So India, you are in a great place. You have the best infrastructure. I studied in my primary school, man, in a Panchayat school. There is no level table. We sit in the bottom floor. Okay, so you have the best infrastructure today. Okay, and I think you're able to ask question. So these are all fundamentally different from what my generation is. Okay, so you are in a better place. Till 2100, India is going to be the youngest country in the world. Nobody can change. Nobody can. When everybody wants to come to India, don't think they love India. Okay, they don't think they love India. They don't think they love you and me. Okay, they know the market is here. Okay, so when you have a market, you better be here. If you go there, there's no market there. The market is here. So you have great opportunity to succeed in India.
Thank you, Ella. I think we need to close the question section here. But I want to give privileged question to our compeer. She asked the first question. So go ahead,
She's the first one.
So, I'm from the field of psychology, and as all of us are predicting that next pandemic is going to be hitting the mental health of everybody. Now the virus, the vaccines are not only for virus, for every other thing. So can we have a vaccine to deal with our mental health issues? Because as I'm also a counselor, where I see everybody has few symptoms of anxiety and depression, and as for US magazines and reports, they're saying depression is going to be the common cold for our universe. What can we do for them?
I mean, if you ask me mental health, this is the totally unspoken field in the country.
Absolutely.
Okay, it's one of the most important. Many village, rural, to rich, to poor, everybody has got a mental problem. But we don't, culture doesn't admit us. Culture, the problem, we don't want to admit a lot of things. But certainly this field, whether the vaccine will come, I doubt. But anything you target on the human body, on a body, it can be one side, but it may affect other things. So we don't know what other things will happen.
Thank you so much. Thank you.
Thank you. We close here. Thank you, Ella, for a wonderful presentation. And my apologies, we could not take all the questions, but you could email questions to Ella. Is very prompt on the emails. I invite Bharat and our Chancellor to come on the stage to felicitate Dr. Ella Krishna.
I'll come down. No, I'll come down. No, I'll come down.
May I request our Pro VC to join the guests? Thank you so much, everyone. Now the Changemaker session is officially over. I request all the guests and the students from other schools to be present here so that we can continue the next session.